Hi, I'm Lorene Guerrero.
And I'm Janine Sullivan Wiley, and we're both mental health first aid instructors.
And this is Algie, the program's mascot. And we'll talk a little bit about what Algie is during this talk. We are here to kind of talk to you about mental health first aid, what it is, why it's a great tool to have in your toolbox, not only for Mental Health Awareness Month, but forever.
And why now?
Yeah.
This is a really good time to be talking about mental health first aid, and not just because of May, as you said.
Absolutely. Absolutely, Janine. So one of the things I think that's gotten me through the pandemic is actually I became certified back in 2018 to teach the in-person class. And when the pandemic hit, the National Council created a virtual program. And Janine and I both were fortunate enough with Mental Health Connecticut to become certified to teach the virtual program. And she and I, in that process, she's been a great support to me. I've learned a lot from Janine through teaching with her. We have a great collaboration, and we both really are passionate about the program and how it can make a difference in helping someone that's going through a mental health crisis or is struggling with a substance use.
Yeah, and then I started training, the in-person training, back in 2013, and the transition to a fully virtual format like we're using here has been a little bit tricky, but Lorene has been just a great partner. And I would say we enjoy teaching this together, and I think we both are so impressed with its impact on the students.
Yeah, absolutely. Absolutely. So what is it? So for some of you that don't know, I'm moving.
So if you don't know what mental health first aid is, everybody probably knows about, kind of regular first aid, which you may or may not have been trained in, and you may or may not have ever used. Mental health first aid focuses and teaches you how to identify, understand, and respond to signs of mental illness or substance use disorders, and then gives you the skills you need to reach out and support someone who may be developing a mental health disorder or a substance use disorder. I kind of think of it as learning to understand what may be going on, when it's appropriate to intervene. And then the part, like, sometimes people may think, I should say something, I should do something, but what do you say? What do you do to intervene appropriately and not be obnoxious or intrusive, but truly helpful and supportive? And mental health first aid teaches those skills beautifully.
Yeah, I think that is one of the most important things. Is there's things that are helpful to say when someone's struggling or when someone's in crisis. And the program really does teach you the difference in knowing if someone's in crisis and what's helpful and what's not helpful, because we've all experienced both. So gives you those practical tools and skills, helps you really realize what is going to help somebody and how to connect them to professional help. So the whole thing about the program is you're noticing, you're not diagnosing. So it's not going to make you a therapist, but it's just going to make you much more aware to get someone you care about or someone just in your community that might be struggling, connected to the help they need early. Like any illness, one of the things that this research-based program shows is that, most people don't get connected to the help they need early enough, right? So recovery is much more possible when you have early intervention. And that's what I love about mental health first aid.
And it covers that whole kind of the whole scope, from early intervention, which is when anything is always the most effective, through, and it helps the participants learn how to identify, is this early intervention? Is the person in a crisis? Is the crisis heating up? And to understand what are the appropriate interventions at each of those stages, because they really are different. The new curriculum, when they went and developed the fully virtual one, they also included more on trauma, which I think is great. They included more on self-care because, Lorraine knows this is like my favorite expression, you cannot pour from an empty cup. So, how to make sure that you're in a good place to be able to help someone else. And it's also got more where it's integrated substance use disorders with mental health issues. And I think those are important. Also, how to intervene if there's either some risk of suicidality or active suicidal intent in someone. So this is a program that can save lives as well.
Exactly. What else? So the ALGAE, why is this called ALGAE? So the program teaches you that action plan, which really is kind of starting from a place of assessing a person and then giving them reassurance and listening non-judgmentally. That's really key. And that's a skill that we all have to practice every day. And then it shows you how to encourage them to get professional help and also self-help and other support strategies. So it's a comprehensive program that combines a 2-hour, right now the virtual is 2-hour self-paced course that you do online, and then it's a full probably 5.5, 6-hour program with breaks, 6 to 7 hours breaks, but it's well worth it.
And not all of that is instructional. One of the things that Lorraine and I feel strongly about is, although they say that technically it's about 5.5 hours of flat out instruction, we like to deliver it in a little more relaxed format so that people can get a break, because looking at a computer screen for hour after hour after hour is exhausting, and I don't think it's good for learning. So people get breaks about every hour, and we give folks a lunch break so they can step up, move away from their screen, because we believe in self-care and self-help. And, I would also add, I've taught a lot of these classes, and I can think of several instances where actually a person has used the skills that they were in the process of learning between parts of the class. Sometimes the old class used to deliver it in 2 days, break it up over 2 days. So sometimes it was between the first half and the second half. And there was another instance where literally during the class, a person had to step away from the class and was able to help their daughter during a really immediate crisis. And that person came back to the class and said, a bit astonished but very happy. It really works. I mean, it actually works. And I love that. It is evidence-based, but when you hear people come back to you and say, I used it, within a week, and how effective it was, giving people those tools.
Absolutely. So, and especially now with the pandemic, folks, there's been a huge increase in all age groups of folks reaching out to hotlines, and especially with young people having to be doing school online, folks, the numbers are astonishing, how much of an increase there's been in hotlines and people reaching out for help, as well as
increases in the rates of depression and anxiety. This has been a rough time for a lot of people, and with mental health first aid, you can make a difference.
Absolutely.
Which is, to me, the best part of it.
It is.
Make a difference and help people in a meaningful and effective way.
Yep. So it's a great thing to add to your toolbox. If you want to learn more, you can actually, Mental Health Connecticut has on their website a whole page that kind of reiterates a lot of what we talked about today. There's also a video, but you can go to mhconn.org/education and look for mental health first aid if you want more. And Janine and I would love to see you in class. So
thanks very much for listening to and watching our video. Take care out there.